to welcome everyone and thank you for coming. And again, I'm John Lewin. I'm the CEO of Emory Healthcare, Executive Vice President for Health Affairs for Emory University. And I'm absolutely delighted and honored today that we have Governor Brian Kemp with us. So, Governor Kemp, thank you very much.
Well, thank you so much, and good afternoon, everyone. Thank you all for being with us today. I also want to continue to thank Dr. Toomey and her team at the Georgia Public Health Commissioner's Office and all the hard-working public health folks all across the state. And I want to thank Dr. Lewin and the whole team at Emory for hosting us today and really appreciate all the hard work that they are doing. Dr. Lewin was just letting me know how quickly they're deploying the vaccine, which is very exciting news, and we're hearing that all over the state. I'm going to have just very brief remarks today so Dr. Toomey can provide an update on where we are on the vaccine rollout, and our experts can talk more about the Moderna vaccine the state is set to receive this week. Let me just again reiterate my gratitude to the Trump administration, Operation Warp Speed, and really a lot of healthcare experts, public and private, that have partnered to roll up their sleeves on the vaccine development, deployment, all the testing and everything else to get this approved so quickly yet so safely. As I said the other day, we are seeing a miracle of modern science happen right before our eyes, and it is well needed, I will tell you. We're certainly excited to be receiving 174,000 doses of the Moderna vaccine this week. Dr. Toomey can speak to more specifics, but I can tell you this. This vaccine will be easier to deploy and store, and it will be going to hundreds of public health sites, hospitals, pharmacies, and clinics all across the state to inoculate those healthcare workers under the Phase 1A program. As I said last week, these vaccines are safe, they're very effective, and we are working nonstop to get them out to our fellow Georgians following the CDC guidance. We are also eager for our long-term care facility residents and staff to start receiving the vaccine. We expect that will begin next Monday, December the 28th. And before I turn it over to Dr. Toomey and Dr. Rufael, I want to give a quick update on where we are in the fight against COVID headed into the holidays. As you all know, we've continued to see our numbers increase over the last few weeks in every metric as we have seen. And we continue to ask Georgians to do their part to help us stop the spread. Wear your mask, practice social distancing, follow the public health guidance that we have out there that's outlined in our executive orders, and continue to use good hand hygiene. This guidance has been in place for months now, and it has proven to be effective in slowing the spread of the virus, and we especially know that coming into the holiday weekends. We continue to be in regular contact with our hospitals, CEOs like Dr. Lewin here in the metro area as well as throughout the state, to hear and see what they are seeing on the ground and adjust course if needed. I'm happy to report that on December 30th, I'm happy to report that by December the 30th, we will have an 80-day supply of all PPE on hand, ensuring that we have critical supplies to face the virus head-on in the coming days and weeks. Last week, we talked about the need for additional staff augmentation to ensure our healthcare facilities have enough people to care for Georgians who need them. And we are proud to announce that working along with Speaker Ralston, Lieutenant Governor Duncan, the House and Senate Appropriation Chairman and members, that we will continue the state's commitment to hospitals and nursing homes with staff augmentation, with the initial projections putting us at nearly $70 million additional dollars that will be spent through March 6, 2021. Following the passage of the new stimulus bill, we have more good news on that front. Thanks to the bill's passage and signing by Congress and President Trump, and increased flexibility as a result, we're going to be able to add an additional $8 million in staffing support where it is needed most in our hospitals, including here at Emory. We are also taking steps once again to address another need that our hospitals have been telling us about in recent days, and that is capacity. In concert with rising cases and hospitalizations due to COVID as well as other procedures, our hospitals have seen an increased need for bed space to treat other patients. And just as we have before, the state is activating a rapid plan to increase capacity and ensure our hospitals are not overrun. I have authorized the reopening of the Georgia World Congress Center Alternative Care Facility with 60 new beds to assist with patient overflow. We each continue to work with our hospital leadership each day to see what new capacity we can bring online, and we expect that the World Congress Center will be able to accept patients by next week, with operations continuing through the month of January. This is being done again through our partnership with Grady Health System. I want to again thank the folks at the Georgia Coordinating Center for helping us act quickly and alleviate strains on hospitals throughout the state. As we look to Christmas and the rest of the holiday season, I know that many Georgians are anxious to spend time with their loved ones, and believe you me, I am as well. But we are also pleading with Georgians once again to do the right thing and stay vigilant. Do not let your guard down, and choose to be part of the solution, not part of the problem. The threat of the virus is still very real despite the vaccine. The general public will not be able to be vaccinated, as we've said for weeks now, for a couple of months. But in the meantime, Georgians, please help us continue to hunker down to stop the spread. Continue to follow the 4 things that we've been talking about for a very long time. Wear your mask, wash your hands, practice social distancing, and follow the guidance from public health officials. And where possible, please limit your holiday gatherings to just a few people in the same household, or consider gathering virtually. If you have outdoor heaters or other means to bear the weather, which is probably not going to be good on Christmas Day from what I'm seeing, gathering outside or trying to spend time outside is definitely helpful. I'd also like to encourage everyone to continue to take the steps to socially distance yourself from those you don't normally see. I know this is hard, but I know that our brave healthcare heroes, including those right here at Emory, need all of us to do our part to keep the virus at bay while we roll out the vaccine. This long battle, as long as it's been, we know it is coming to an end with this vaccine that we have before us. But that being said, we cannot let up. We have to continue to focus on celebrating safely to get us through the holidays as normal and as quickly as possible, so that we can continue the methodical reopening of our economy and weathering this COVID storm until we get everyone in this state vaccinated. So thank you all for being here with us today, and now Dr. Toomey will provide you with the update.
Thank you so much, and it is particularly a privilege to be here today, not only because of the long history of partnership that we've had between Emory and public health, but also for the fact that the Moderna vaccine was actually tested here, that one of the clinical trials took place here, and we are reaping the benefits of that work. And I'm pleased to say that our first doses of Moderna vaccine, the 174,000 doses that have been allocated are in the process of coming to us even as we speak here right now. We've gotten our full allocation of the Pfizer vaccine. That's 125,775 doses. Those first allocations went out to facilities that had the ability, in large measure, to use that ultra-cold freezer capacity because of the difficulty in maintaining that vaccine. But additional doses have shipped out. And we are also pleased that through our partnership with CVS and Walgreens, 20,000 doses will begin that process, as Governor mentioned, on Monday. will start to vaccinate long-term care facilities. We are in ACIP guidelines 1A, that is healthcare workers, all healthcare workers, regardless of where they practice, whether in the community, in the hospital, through public health, or in long-term care facilities, as well as long-term care facility residents, really thought to be among the highest risk individuals in the state. And so we are pleased that we are able to roll that out right now and make that partnership happen, which will touch at least 95% of our long-term care facilities. Public health will be working in partnership with the other facilities that have not enrolled in their program. I also wanted to point out that you may have noticed that that we have currently have a dashboard up on our website that really will allow us to track where we are in terms of vaccine allocation, how many providers we have currently, 746 when I last checked the website, and we will be adding more and more as we move forward, because I think there's more and more interest and more engagement with the provider community. And I'm pleased to say that 246 facilities, both hospitals, provider groups, as well as public health departments and pharmacies, have placed orders and have either received or are in the process of receiving over the next several days or weeks to come additional orders for either the Moderna or Pfizer vaccine. And I'm also want to point out that these providers are in all parts of the state, and these facilities receiving the vaccine are in all parts of the state. The initial tranche of vaccine from Pfizer largely was focused in areas that had the availability to use the ultra-cold freezers, and so there were parts of rural Georgia, including our own public health departments, that weren't able to receive them. With now the Moderna vaccine, we can literally cover the state with vaccinations, and we're very excited to begin that process and continue to roll that out. And so I urge you to follow the dashboard, follow the progress, although there will be a delay. There often is a delay in as long as 24 hours from the time a vaccine is delivered to the time that it appears on the dashboard. But we know that there's a total of 17,500 vaccines administered, and just in talking to Dr. Lewin just now, I'm sure that many of their vaccines already are in the process of being entered, and that number will increase dramatically over the next days and weeks ahead. So let's keep track of that. We can monitor that, but recognize that there will be a 24-hour delay as we move forward. And just finally, the last thing I want to say is to reinforce something that the governor said. Today, we've reported the highest rates we've ever seen in Georgia, highest numbers of new cases. Just because we have a vaccine now, just because we are now actively engaged in important partnerships throughout the state to vaccinate our healthcare workers and highest risk individuals, and we'll be moving into the broader community, we hope by late January, February. We can't let down our guard. We have to continue to practice those preventive measures that are tried and true because we are seeing rates increase, and we have to stop the spread even before the vaccine becomes fully available to the state as a whole. Thank you again, and thank you in particular to Emory for their partnership and ongoing support for all of our work in COVID, and particularly for their work in the vaccine partnership. And let me turn it over to Dr. Lewin to take it from here.
Thank you, Commissioner Toomey. I want to take this opportunity to thank Governor Kemp and Commissioner Toomey and their teams for their work and dedication in bringing not only the Pfizer vaccine, but also now the Moderna vaccine to the people of Georgia. It's almost cliche at this point, but we are truly navigating through some unprecedented times and challenges. Our ability to work closely with Governor Kemp, Commissioner Toomey, and their teams enables not just our clinicians, but also our researchers and public health experts to extend the reach of this work throughout our state and beyond. The remarkable speed with which we now have a safe and effective COVID vaccine available in our arsenal reflects the cooperation and unyielding perseverance of the diverse teams from our government and our academic communities, along with private industry, all of whom continue their dedication to solve this problem. This, too, has been unprecedented and is largely why we're able to convene today to recognize the collaboration among our government, research, private industry, and clinical partners to better understand how this vaccine works, how it can be an effective tool in our efforts to fight COVID, but most importantly, why we encourage Georgia citizens to receive it. As my colleague, Dr. Orenstein says, vaccines don't save lives, vaccinations do. So as soon as you have the opportunity to receive the vaccine, please be sure to do that. While we're not yet out of the woods, and as the governor has been encouraging since the spring, we need to continue wearing masks and face coverings, practicing social distancing, washing our hands frequently, and following all the guidelines from public health experts. And with these actions, we're now finally on the road that will lead us to recovery. The work of our frontline healthcare workers has been remarkable, learning and adapting to new treatment protocols and strategies for managing this new virus, and our researchers have been equally effective in developing what clinicians need to do their jobs. Better testing through our service as a primary National Institutes of Health site to validate new COVID test technologies from across the country. Better treatment options as a leading clinical research site for remdesivir and other new medical therapies, and more effective prevention. Through our work across Emory Healthcare and by our Emory faculty at Grady, at the VA Medical Center, or at Children's, as a research university, our people are working hard to accelerate new knowledge and apply what we are learning to fight this pandemic. Before I turn it over to Dr. Raphael, I would be remiss if I didn't acknowledge the tremendous support of our community, from those who volunteered to participate in clinical trials, whether vaccine trials or therapeutics, to those who donated supplies, meals, and funds, and of course, to our partners in state and local government. We are tremendously grateful. I'm pleased then to introduce Dr. Nadine Raphael, professor in the Department of Medicine and lead investigator in the Emory Vaccine Center.
Thank you, Dr. Lewin. I would also like to extend my appreciation to Governor Kemp and Commissioner Toomey for visiting Emory on this very special day. Thanks to effective and safe vaccines, we can begin on the road to recovery from this pandemic. Emory was just the second site in the nation to begin testing for Moderna COVID-19 vaccine. I recall we were enrolling the first subject in the remdesivir research trial when we received the call from the National Institute of Health to start preparing for the implementation of the vaccine trial. The first participant was vaccinated at Emory on March 27 as part of the phase 1, the same month our state faced local transmission of the virus. In April, Emory was the first in the world to vaccinate an older adult with the mRNA vaccine. The phase 3 for Moderna started in the summer and led to those astonishing results where in just few months the vaccine was shown to be safe and 94% effective in preventing symptomatic disease, a true medical breakthrough. Emory enrolled some 700 adult participants in phase 3 of the Moderna trial across 3 clinics, the Hope Clinic, the clinical arm of the Emory Vaccine Center, the Emory Children Clinic under the leadership of Dr. Anderson, and the Grady Clinic under the leadership of Dr. Kelly. At a time where it's important to build trust for COVID vaccine in minority communities, Emory enrolled one of the most diverse clinical trial population in the nation. At the Hope Clinic, 47% of vaccine volunteers were from underrepresented minorities, and at the Grady Clinic, the number was 75%. Emory was able to successfully enroll minority participants by relying on a long history of outreach to at-risk and minority community through HIV vaccine and engaging with the coronavirus prevention network. None of the scientific accomplishment could have been achieved without the support of our community and the dedication of the staff as well as the faculties. Emory is also the home of the Infectious Disease Clinical Research Consortium, that's IDCRC, which is the largest clinical trials network in the Division of Microbiology and Infectious Diseases at NIH, and had been working to accelerate COVID vaccine research. Our journey to this leadership group began several years ago with investment in infectious disease research and faculty and the development of the Emory Vaccine Center. This network of expertise and resources allows us to diversify the approach to prevent, treat, and evaluate infectious disease, not only nationally, but also on a global scale. Our work in this area will continue long after we have defeated the pandemic, thanks to the foresight and collaboration of our federal, state, and local government. Thank you.
All right, do we have any questions for Dr. Toomey, myself, Dr. Lewin, Dr. Ruffiel? Yes. Dr. Toomey, yeah, probably better.
In our planning meeting today with the district health directors, we talked about that. We anticipate it'll take us pretty much the month of January to finish. All the healthcare providers, and there are more than 500,000 healthcare providers broadly defined, although at the rate that Dr. Lewin is managing to immunize, I think we may finish faster, but throughout the state, in fact, our district public health is actually working and setting up clinics for those providers that aren't themselves enrolled. So they're having provider clinics in the health departments for other providers. So that's another additional way that we're going to be reaching them. But we figure that it'll probably take as much of the month of January. But we're hopeful that by end of January, beginning of February, we'll start to roll into Phase 1B, which is a significant number of people, which includes critical infrastructure workers as well as older individuals.
Yeah, I'll let Dr. Toomey follow up. I will tell you that we actually had a conversation about that this morning and continue to talk about how we're going to do that. We are talking to anybody and everybody that would fall and meet the criteria to give the vaccine. I'd much rather have the problem of not having a provider, not having enough vaccine to give than not having providers and have more vaccine than we have people to give shots. But we're talking to the Pharmacy Association. We're going to be talking to, large public and private companies that have the facility. A good example would be a grocery store chain that also has a pharmacy. They could actually administer the vaccine there. So, we are leaving no stone unturned for how we get the vaccine. We know the second part of this is going to be a lot more spread out than trying to vaccinate people at a place like Emory. But Dr. Toomey, do you have anything you want to add to that?
The answer is yes. We're going to do all of those. Sure. I mean, because we would like very much to have primary care doctors working with us and have encouraged them to enroll as providers. And many of them have already worked with us for many years as providers through the Vaccine for Children's program. And so they're quite familiar with how to enroll. And many have, and we are continuing to reach out. And I have personally had conversations via webinar with the various medical associations, the Medical Association of Georgia, Academy of Pediatrics, Academy of Family Physicians, to try to not only encourage them to be vaccinated, but also to participate with us. And so we anticipate that we will be doing that, as well as mass vaccination, not unlike the drive-through influenza vaccine campaigns we've done in public health, and working also with the pharmacies. So we're going to use as many different venues as we can and many different partners as we can to cover the state. It's already been done, and back in October, over 95% of the facilities signed up for this Walgreens CVS partnership. By doing so, basically it's a turnkey operation. They sit back and the pharmacies come in. We allocate the vaccine to them. So they've gotten their first allocation of 20,000 doses, and they'll continue to get, as we get our tranches of vaccine. In this case, they'll be getting Pfizer throughout the course of the vaccination effort for the long-term care facilities. We'll continue to provide that, but they will actually be delivering the vaccine not only to the residents, but also to the healthcare workers in those facilities who are themselves not only at high risk, but also at risk for transmission to others. So we're actively working with them. For those 5% not enrolled, some have enrolled themselves to be providers. Others will be vaccinated by the local health departments in their area. I just think that having maximum transparency of where we are and how far we've gone. I think there's always been a question of how many vaccines have you received, how many have been delivered. There's a lag between the receipt of the vaccine, getting the vaccine out to the providers, and then getting those vaccinations once delivered reported because of the delay in grits. But I think it's to ensure that we have full transparency in everything we're doing. This is so important. This is, as you may have heard me say last week, I'm hoping this is the beginning of the end of this pandemic for us here in Georgia. But it's going to require full cooperation, not only of all our providers, but of all Georgians to take part in this. And so it's just to reassure people of what's happening and where we're going. I don't have that right off the top of my head, but we're expecting in the next several days and some early next week. So some are likely to be here either later today or tomorrow before Christmas, and then next week as well.
Yeah, we know the cost. I don't know what it is off the top of my head. We've been kind of working on, as you can imagine, there's been a lot in flux as we've tried to prepare for something like this. You know, we've had this whole surge capacity plan for a long time. We've used it twice now, and we're ramping it up again. But trying to figure out how we were going to pay for it if we got to this point over the last 30 days has been rather challenging, knowing that previously, before the vote last night, we couldn't use the CARES Act funding past 12/31. Now we have that flexibility. So like everything changed over the last 24 or 48 hours, but we can get you the figures on all of that. But it's going to be in line with what we were doing, and you know we'll be able to handle it. I know the hospitals need it, and it'll be great to have. But we're working on other things too down the road, just so we can be over prepared, and hopefully we never get to that point. I did want to just say one thing too. I know I've gotten the question on public confidence of the vaccine a lot. I want to again thank Dr. Rufael and Dr. Lewin and everyone at Emory and everyone that's participated in all the trials. I think my fellow Georgians can feel heartened by the fact that people right here in our state have been working on this for many months, as she described, really the whole pandemic. Our our own folks that participated in the vaccine trials. You saw how excited Dr. Toomey was. Last week I talked to her, I think it was yesterday, and asked her how she was feeling on the backside of the vaccine, and she explained the experience she had, which I can let her tell you about that, but I think it was a very good one. And that's what we want to continue to build, is that confidence, because like Dr. Lewin said, I'm going to start stealing this line from you, John, but it's not the vaccine that saves lives, but it's actually getting vaccinated that saves lives, and that's what we got to do. Anybody else? Yes. I mean, I can let Dr. Toomey speak to this. I don't know that we've had any real logistical hurdles other than the initial trying to figure out like how the process was going to work, that the feds were doing, what they were shipping, where it was going, which, we weren't necessarily a part of that. We were just waiting to get that information. So I don't know that we've had any issues getting it out there. I think down the road is going to be where our challenge is, getting it to all parts of our state and out to the masses, and trying to figure out how we get people to go where, get them to volunteer to do that, have enough providers in those areas. But we have a lot of great things that we're working on. Like Dr. Toomey said, we have, I think, literally hundreds and hundreds of providers all over the state that are signing up to be able to do this. We've been talking with the local hometown pharmacists, the big folks, grocery store chains that have pharmacists. Some of our long-term care facilities have their own means to give the vaccine, which is why they didn't sign up with the CVS-Walgreens partnership that Operation Warp Speed came up with, which was, I think, in my opinion, was also another brilliant move to bring the private sector into this and to take government out of it, and they just streamline that process, going straight to those facilities, bypassing the state. Comes out of our allotment, but it's not something that we have to necessarily engage in, which I think, from my perspective as governor, is a good thing. So we have a lot of really good things going on right now, but we still have a tremendous amount of work to do. I think it's everywhere. I think if you look at our maps now, we're just seeing cases rise, and just, either orange or red in just about every county, which is why we need people to really hunker down. We've been through this before. We've had some holidays that were bad, and we've had other holidays that ended up being not so bad. We need Christmas to be not so bad, because obviously something's been going on really prior to Thanksgiving and from Thanksgiving. A lot of talk and studying now about a new strain and what that means. I don't know that we have any idea where that's going right now. It doesn't matter. We know that the vaccine's going to work regardless, and we know that socially distancing, wearing your mask, and follow the guidance will help us in the fight until we can get enough people vaccinated that we have herd immunity. Yes. Yeah. Yeah, I may let any of the experts here talk about that. I just know what I've been reading and what some of the studying that is starting in the UK, and I think I read something where they may be starting to look at it here in the United States, but I haven't been briefed on that yet, John. I don't know if you and Dr. Rufael want to speak to that.
Yes, obviously everybody's concerned about the potential of the vaccine still working against this new variant. It's not unusual for the virus to mutate. It had mutated before, and the vaccine was still effective against it. It's just a matter of time to be able to confirm that the new strain is still sensitive to the vaccine.
Anybody else?
No, it was, I was quite excited to be vaccinated. I think it was, for me, such a relief. But I did develop right after, about an hour after being vaccinated, a sense of almost like heat in my cheeks, flushed cheeks, which lasted about 3 hours, and a sore arm, which lasted a couple of days. And that's really all. It was really actually less symptoms than I had when I got my Shingrix shot last year. So I'll be vaccinated again in 2.5 weeks, and see how the second dose goes. And to the individual asking me about the Moderna, that's going all over the states, so I don't have the exact facilities right in front of me, but just to reassure you that it's not just focused in metro area, it is all over, it's going all over the state, and including some of the health departments who don't have those deep freezers that are required for the other vaccine. I hope so. We're anticipating that school teachers will be in that group, that will be a priority in that group, and we're hoping we'll be able to partner with schools as well as school nurses to help us deliver those vaccines. But we're just beginning the planning for that now. It's not too early to plan, even as we're rolling out Phase 1A, and we will be getting those discussions in the next days ahead.